Hi, good evening to one and all. I would like to welcome you all for Dental Genetics Clinical Diagnostic International Conference. I'm glad to be here. I would like to share my thoughts about the challenges the dentistry is facing in today's world. Dentistry has become a very competitive field, and added to that, we have a lot of altered social scenarios, both social, economical, behavioral, as well as people understanding towards the profession itself. Hence, I will be covering a topic which would give you a little insight about what is a present day dental practice and how that has tremendously influenced and impacted by the digital era and the digital revolution. I once again like to welcome you to my lecture about how to be a successful practitioner in the digital era. The influence of digital revolution is not just in our technological or just at a cellular or a mobile level. It has influenced at every level. Every walk of our life, we've been witnessing a lot of influence of your digital revolution. Be it a microwave, be it your cell phone, be it a technological evolutions in terms of medical, dental, as well as any other professional devices. This brings a tremendous change over the traditional practice, what dentistry has been witnessing over the last few decades. In the last 20 years, the things that have changed here are the patient's understanding about dental treatments, patient's significance towards their own health issues, and post-pandemic era, we've been witnessing more of a proactive patient engagement towards a dental treatment. There used to be a concept of family doctors. There used to be a concept of word of reference, word of mouth, as well as we used to take a reference from the friends and relatives to visit a specific doctor. But that has tremendously changed now. Our traditional practice, which we've been doing it for several years, has been facing a newer challenges pertaining to the patient's behavior as well as patient's acceptance towards a newer treatment aspects. Before I continue with today's topic, I would like to introduce myself. I'm Dr. Narayan. I'm a microendodontist, implantologist, and I have a little experience in various other fields. I've been having a teaching experience of past 20 years, as well as I have been working as a business advisor for pharmaceutical and dental manufacturing companies. It gives me an immense pleasure to share some of my thoughts, some of my experiences spread over the last 2 decades, having multiple clinics, having a training center, being in the corporate world of as an advisor, as a research consultant, and all those things, gives me a little insight about how exactly the whole profession is changing from inside as well as completely from outside this profession as well. This gives me a little vantage point in understanding how exactly to deal with the present day challenges we've been facing in order to be a successful practitioners in dentistry. Let me give a little heads up towards today's topic. For a few, it may be a little confusing. Let me clarify the things what I'm not covering at the outset of the talk itself. We will be talking about the essential requirements of the successful dental practice in digital era, but the digital and dental practice and the success, these keywords may be giving an impression that I will be speaking about search engine optimization, how to attract new patients from the social media, or maybe some of the strategies we can adapt. We will not be discussing those things under this heading. Essentially, I would be talking about the requirements needed for the evolution of clinics, which have been adapted to an older level, older concepts, and how they need to transform themselves to address the present needs of the society. Our society has been tremendously influenced by the digital revolution, and our netizens, our present generation patients are well informed, well studied, and they have access to the abundant information about any given field. From this perspective, today's talk is more meaningful in understanding how to manage these patients and how each clinic or practitioner need to change or adapt to this newer patient category that has been witnessed by the present dental practice. Let us clearly understand, according to patient, what is modern dental practice in this digital era. We all know what is modern dental practice. We all go by the principles, we all go by the protocols and the recommendations and the journals and the reviews. But from the patient perspective, these are the totally different factors. And sometimes it might exactly match the way we think. Sometimes it may be opposite side of the spectrum. According to patient, our treatments are highly scientific and it is being evaluated, verified, and then it has been adopted in a clinical scenario, which is very true, and this is what patient thinks. There is no confusion with the present generation. But way back, in several years back, several decades back, this was the biggest challenge we all used to face, and this is working in our favor in the digital era. The second belief by the patient is the treatment outcome is highly predictable. During the flare-ups or during some of the not expected prognostic outcomes may put you in a awkward situation on the clinical side about like the patient expected something and then probably you're not able to deliver it. According to patient, our modern dentistry is very predictable and very scientific. Patient also thinks that our treatments are very accurate and very precise in the digital era, because this is what he's been witnessing in the other fields of medicine itself. The keyhole surgeries or microsurgeries and all these things have given him a kind of a understanding that even in dentistry those things are quite possible, and it is possible under a magnification and with so much of advancements in the scanners, CBCTs, or in our endodontic apex locators, and many of our treatments have been streamlined and reduce the human bias or operator bias factors. Hence, the treatment outcome is more predictable in present day compared to the older generation. The evidence-based approach, it is not an experimental cases on any given patient. This is what patient thinks. Every treatment is more evidence-based, that has been proven, hence the doctor is suggesting me this particular treatment. Now, let me walk you through a process of understanding what are the key elements that will play a major role in achieving a successful practice. We can categorize them under three categories, and these three categories have a greater influence in achieving an immediate success, a sustained success, as well as a success which is for many decades to come. Under this category, we have a patient factor, a patient conversion factor, and a retention factor. The patient factor is nothing but how does a patient select a clinic. Conversion is like what are the factors that will make the patient to either accept for the treatment or reject the treatment and then go for a second opinion. And the third most important factor is the retention factor. If the patient is happy with your treatment and your process, he will stick to you for a quite long period of time. Once any patient is remaining with a specific clinic, there is going to be a very rewarding achievement that will come through his referrals, his family members, and his friends and relatives. Now, let us see one by one in detail how do they control our overall success. Let us understand the patient factor first and understand the other factors in tandem. Let us understand the patient factor first. A patient classic journey of selection of a clinic, doctor has been tremendously influenced over the period of time. Previously, it used to be a family dentist or a reference to any particular doctor through friends and families or neighbors. Now that has been transformed into an app-based or a mobile-based applications where he can search for a given specialty doctor. And the same thing is true for a dentist as well. When someone has got a dental problem, more than remembering a clinic nearby, the most accessible thing for him would be a mobile phone or a computer or maybe a laptop through which he can make a search for a local dentist or any specific specialty dentist required by him. Now the question is, are you present in that search engine? Are you available when on the platforms where he's searching for a specific clinic? Once he identifies a specific doctor, then the second process is coming to a clinic, and then he has to be given a specific, most accurate diagnosis, and then he makes it that several treatment options will be provided to him. When we're going through this process of getting the patient and getting the patient, walking the patient through a process of understanding his problem and the treatments pertaining to that, he or she would obviously go for some other references, maybe a Google, maybe a YouTube, maybe other things. If his knowledge and the treatment options provided by you are same, there's a high possibility that he might accept for the treatment. When there is a discrepancy between his understanding and the diagnosis and the treatment plan provided by a clinician or a doctor, then probably a brand or credibility of a specific doctor will play a huge role. The retention factor as well is basically depends on his experience during the previous visit to any given clinic. If I have to interpret the patient decision-making journey specifically for dentistry, there has to be a need recognition. That means patient should experience one of this issue. Either he should have a pain, some sort of a discomfort, that may be a bleeding gums or maybe a bad breath, or maybe some aesthetic related issues, or probably maybe a preventive. This will make the patient to identify that he needs to see a doctor. That will basically come under a patient inflow. That means the patient is technically ready for visiting a clinic. Now, if he has to come to any specific clinic or if he has to come to your specific clinic, there are a few things that needs to be in place. That means your presence, not just a board, not just a signboard or not just your huge boards of attraction on the main roads. That doesn't help. In the digital era, what is transformed, what is changed is we need to have our presence in the Google or in several all possible social media, and also there need to be some kind of a word of mouth spreading about you in the neighborhood. If it is easier for a patient to choose you or choose any clinic, if that has been seen on the social media or Google, and then it is also referred by a family or a friend, then he's got a double confirmation that his decision is good. This is basically how a patient selects a clinic. Then comes based on his fear about the pain, based on his importance towards his own health or economical reasons, and maybe something related to personality issues. All these things will make the patient to either aggressively look for a treatment, or maybe he might avoid the treatment. And if he is avoiding the treatment, he would always look for an alternative therapies, and that is where the patient is basically confused or not ready, maybe due to the dentist or maybe due to the doctor's inability to explain the treatment, or maybe his own personality disorders or his own bias towards the dental treatment, making him to not to go for a treatment. The decision category is facilitated or augmented how much of branding you have in the society, how well patient recognizes you as one of the service provider, and your own credibilities in terms of your skill sets, your super specializations, your other skills, and also most importantly the reviews, not just a Google review or a Facebook or Instagram reviews. It is about like what the society speaks about you. These are the things will induce the patient to take a quick decision about the treatment. Once he is comfortable about the treatment cost factors and the way that has been conveyed to him, he makes a quick decision. If there's any confusion, probably he would delay or he would not make any decision about the treatment. Based on the how well the treatment went through or how what was the pinch on his pocket, all these things will make him to think about whether he wants to continue with you or not. It is several factors which pertaining to his experience with his previous treatment with you will decide whether this patient will be adhere to your clinic forever or maybe he start switching and looking for alternative clinics. Once we understand the patient's decision-making journey, one has to be very clear about as a practitioner or as a clinic owner, are you capable of comprehending his patient's demands? Now, the whole society has changed, our whole healthcare ecosystem has changed from the service perspective. Here, what has happened? A corporate chain of clinics or a corporate hospitals or anything pertaining to be it a spa, be it a beauty clinic, or be it any healthcare segment has been tremendously transformed to serve the patient needs. From that aspect, patients' expectation about a healthcare service providers have been tremendously changed and it has been influenced by a corporate world. Now, as a clinician, as a dental practitioner, one has to have an idea what is that in his zone and in his territory, the way the things have changed and whether his practice is in par or in very similar line with the other service providers. When it comes to Indian dental business, our practo and the appointments scheduled through the third-party applications have tremendously influenced the patient. Now, the patient behavior is very similar to like the way he gets a Uber car at his doorstep, or maybe the food delivery system through any given restaurant. From the patient perspective, it feels that everything is available with the touch of a button. Patients' expectations and demands have been tampered or have been influenced because of these changes because of a digital revolution. When a patient gets a quick appointment, when the patient medicines and other things are available with the touch of a button, and when other services are being provided through an online consultations and all those things, he comes with a very similar mentality and expecting a similar kind of a quick, rapid solution to his problems. The major impact is how the other digital platforms, other digital services have entered into the healthcare industry and how they have influenced the patient behavior in terms of expectation and as fulfillment through the greater and efficient services. This has impacted a patient's mindset and he expects a very similar kind of services through the dentistry as well. The social network has tremendously impacted on a patient's behavior in terms of like he can discuss with many patients with the same problems. If he's got some toothache, if he's got some spine issues, if he wants to go for an orthodontic treatment, he can find his category of patients or his kind of a problem associated individuals across the globe and he can get connected to them. And he can also take an opinion from all those patients, not from the doctors. He can also get an opinion from the patients with the similar issues and they might sometimes give a good advice sometimes and many times there can be a tampered information. Maybe somebody's individual recommendation may be influencing this particular patient. Once we understand the patient factor, now we need to move on and understand the second important factor, that is a patient conversion factor. How does a patient get convinced for a treatment and what are the factors that would influence the patient to make a quick decisions and what are the factors that might affect to the patient decision in a negative way. When the patient has already made a choice and he's already in your setup in a clinical atmosphere, now his decision is not final. He's still under some kind of a confusion. The typical mindset of a patient when he's on the chair or while discussing the things across the table with a doctor, these are some of the questions. His fundamental thing is, it is always like, am I in the right place? What is the, he would be looking for some kind of a support or evidence that he is making a right decision. His other question is like, is this doctor experienced? Has he got a sufficient experience to provide me a best treatment? And also, it's some kind of a post-pandemic mindset is something like, am I in a safe place? Am I in the same hands? In terms of like how neat or how clean or how disinfected protocols are followed in the specific clinic. The fourth and important factor, once the treatment options are given to him, it is the cost factor. That is whether he can afford the treatment or not. That is what he would be thinking. And the final, before making a decision, his question or his, as in like the patient's question is always like, is he making a right decision, or whether he requires to take any second opinion regarding his problem and the treatment options are provided to him. So if a doctor is able to understand these questions pondering in the patient's mind, then it would be easier for him to convince the patient based on this set of questions which any common man would have in his mind while deciding for a specific treatment. As a practitioner, one should be clearly aware of what are the patient engagement tools that would help him for the better patient conversion. Once the patient selects you and he walks into the clinic, the whole practice should be made in such a way that it should be a patient-centric. That means patient is the most important person in the setup and everything works according to his comforts. The second most important thing is the way we communicate. This communication is not just a language skill, it has to have verbal, non-verbal, the clinic atmosphere, the interiors, the ease of process, everything comes under a communication factor. Then the way the clinic is acquired the new equipment, the materials, or the doctors updated themselves has to be conveyed in some way or other. The other important aspect in this category is when patient is shown about the previous very similar treatment that has been recorded, documented to him, there is a highest possibility that he might make a quick decision. For a patient, it feels like this particular clinic or a doctor has already treated such cases, and it would be very easier for him to address his problem because he's got an experience of treating such patient, and that can be proven through the documents, the photographs, or maybe through the patient reviews, or many ways this can be provided to the patient. One of the key element I see missing in a many great clinical practice is this. They have not defined the patient's persona of which they are trying to target. Here, this is the most important slide of today's lecture. How well you have defined your patient's persona and how well you are targeting your brand to convince him. That you have to be very clear about what is the patient category. Is it like a family man, or is it a family, or is it an individual? Is it a young, or is it a geriatric cases or pediatric cases? Whom are you trying to attract? Who was your primary category of the patients whom you're trying to connect to? And this is an important thing when it comes to your branding. The branding basically helps in quicker decision or in terms of enhancing your credibility when the patient walks into your clinic. Hence, the images and the brand narrative and the quality of content and the originality or the consistency should match a brand or the name what you are trying to establish in the society. If there is a discrepancy in this, there will be a lot of conflicts in the clinical practice. User experience, user interface, it plays a huge role in terms of before he comes to a clinic, he should have visited your website. That should be clearly explaining what you are, who you are, and what are your niche abilities to address a specific problem. This helps in making a quicker decision from the patient perspective about to select you and come to your clinic and then engage for the treatment what you are suggesting for him. In dentistry, the old concept was having a clinic in a prime location in the prime area to attract a good patient category. Those things have been influenced or changed by the Google Map or maybe the GPS system where the patient can find anywhere under the sun. If you have a good presence on the digital platform, you will have a patient to your place. Now, not just having a website, not just having a one page of a social media things. Here, the whole game plan is to have a specific targeted plan to achieve or to attract a specific patient. Hence, your website, the social media presence, and your blogs, everything should be oriented and in par with the brand what you are trying to represent. The frequency of your information, the quality of your information plays a huge role from the Google search perspective. Quality and originality of the information is what Google likes, and if your postings or your podcasts or videos are providing that, it gives a higher ranking. Having said that one, I have also seen many practitioners are just following the routine way of expressing themselves, giving the same information which is otherwise also available everywhere, doing the same things what others are doing. That wouldn't fetch you an additional patient to you. You have to be original, you have to be more resourceful, and also you have to have some kind of associate kind of a marketing services where several other websites, several other digital platforms are discussing about you and your activities on daily basis. That fetches your better ranking and better identification by the patients. The third and the most important factor of essential requirements for a more successful practice is the patient retention. This is the accumulative effect or compound effect you are going to see in your practice over the period of time. If you have a good strategy, if you have a good presence, if you have a good relation with the patients, this third factor, that is a retention factor, will influence your practice and it becomes a self-sustainable practice without much of an effort to maintain it for a longer period of time. Patient retention basically influenced by several factors. That is a patient's experience during his treatment. If there are a smooth flow of treatment and if he achieves a good comfortable results with a scheduled time, he would be very happy and probably he may not look for any other alternative options. But if there is any unwanted, unexpected changes that has been suddenly imposed or given to him, probably that would make the patient very uncomfortable. He may start looking for alternative options. You should always ask a question to yourself that why should the patient come back to you? Why can't you find an alternative? You should have several things in place. That is a patient document, a patient's a complete, a comprehensive report, and also a patient's other treatments which in future might pop up, and you may have a plan for that. This should be explained to the patient in terms of like, you have completely understood his oral conditions and you have resolved his existing chief complaint, and also you are expecting some of the issues in near future or maybe in future, and that you also know how to manage it. Once patient realizes that you have the complete idea about his oral condition and you have a plan how to go about it, those patients will always stick to your particular clinic. Then the other aspects are like the patient should be frequently reminded about his other appointments, his existing treatment. There should be a periodic call to verify how is he doing about the treatment, what has been completed or performed to him, and he should feel that okay, he's been taken care and somebody is monitoring his health. And in these factors, the patient retention would increase and patient would always either remember you next time, or probably he'll start referring his family members, friends, and neighbors to your practice. This would be very rewarding in the long run. When a clinic is established for 5 years, 10 years, and when you have many patients referring to their friends and relatives and their family members, then your practice will start flourishing. But if that is not happening, and if it has not happened to you so far, that means there is a flaw in the overall system. One has to clearly work on this, and end of your practice, you have two responsibilities, not just resolving the patient issues. You need to nurture your practice for your future days. Hence, the patient retention plays a huge role in terms of long-term success in this present digital era. And in this digital era, it has become much easier to communicate with the patient. It has become very affordable by any practitioner to reach out and to evaluate a patient's condition. There can be many free tools available, and that can be utilized for this particular purpose. To sum it up, the last 30 minutes information, we have to understand that we need to evolve to address the present challenges because of the digital transformation of the society. Hence, the process should be well defined, and whole practice should be a process driven or a protocol driven concept, or else we may have confusions at every level. Our patients are well versed with the process driven healthcare service providers, and hence if we are not following very similar things, probably we may not be able to be very successful for a very long period of time. The second important thing is we should be playing a team game here, not a one-man show. The clinic should be able to attract the patient more than as an individual doctor. Hence, one-man show or a one-man's idea of practicing and he doing all the procedures should be avoided as much as possible. On the long term, this is not a good plan. Then comes the consistency in the quality, consistency in the treatment process, consistency in terms of adaptation of new strategies, new advancements, or skills should be the norm for any given clinic to face the present day challenges and the competition as well. The corporate chain of clinics have very well maintained this consistency in their services. Hence, it has become a kind of a gold standard in the society that even in any private clinic, a patient will have very similar expectations. As Charles Darwin said, it is not the strongest of the species and it's not the intelligence of the species which survived. It is the most adaptable of the species which always made it through. Hence, it is a time for all the practitioners to look beyond our classic conventional way of practicing the dentistry. We have to readapt, redefine our practices to manage, to engage the patients who belong to the digital era. I would like to thank all the organizers of the conference and all the people involved to make this happen. A great event has been planned and executed under the eminent leadership of Dr. Gargi Goswami. I extend my sincere thanks to Dr. Gargi Goswami for giving me this opportunity to share some of my experience and insights about the dental practice in a digital era. Thank you all. Have a great evening. Thank you.